just being that person to give them that space to share what's on their heart, what's on their mind, and just to bring hope to them.
Welcome to Better Together podcast, produced and directed by our Hospice of South Central Indiana, a not-for-profit organization dedicated to making every moment count. We share real stories about hospice, palliative, and personal care services that we provide in 22 counties all over South Central Indiana. I'm your host and president, Steph Kane. Today I have with me Chaplain Mark Phillips. Welcome, Mark.
Thank you.
So glad to have you today.
It's great to be here.
So, Mark, share a little bit about your background and what brings you to serve our community as a chaplain with our hospice.
Yeah, well, I served in the ministry role as a pulpit pastor for quite a while and had some life experiences where I saw chaplaincy as a ministry that seemed to be lacking. I have a grandson who had cancer, and during that time, being a pastor, I had a chaplain come in and they found out that I was a pastor. Well, you probably don't need our services then, and they just kind of didn't really come around a whole lot. But pastors need pastors too. And so being a chaplain is a role that's very important no matter who the person that you're serving is. And it felt like it was something that I needed to step into, that God had called me into. And bringing support and hope and joy to people's lives is just a joy for me.
So good. You know, I think our audience can relate to this in that sometimes they're a caregiver for their loved one, and you're so busy in the caregiving that you can't just be the daughter, the son, the mom, the sister, and it's a wonderful thing when you have the services, the chaplain coming in to care for you.
It's a very important support for sure.
Really good. How do you explain the role of the chaplain on the hospice team?
Well, we exist to take care of the spiritual needs. A lot of times we don't think about our mortality until we must. And there's times when we get into a point to where we don't know why we're feeling the way we're feeling. And sometimes it's just a matter of having somebody to talk to, somebody to sit down with and just hear your concerns. A lot of times we might think that, we're just not good enough, or we're not doing things the way we should, and those sorts of things. And my role is just to kind of come alongside of those who are feeling and just help them express those, as well as just to be that ear. I tell people all the time, I've got big ears and we might as well use them. And so just being there to listen. And I think that that's a very important part of being a chaplain. But our lives, our bodies, our being, our existence is three things. It's not just physical, but it's also emotional and spiritual. And when one is lacking, the others suffer.
One of the most beautiful things about hospice, taking care of the whole person and their extended family and loved ones. So that whole unit together, we provide services. So, while we respect all faith traditions, I'm sure you have your own faith tradition. How do you meet people right where they are and be a support for them?
I think the most important thing we can do is listen. Ask the question, what do you believe? What do you think is going to happen when your loved one's not here anymore? Or as the loved one, as the patient, where do you think you're going to go? What do you believe is going to happen when you take your last breath here on earth? And just being able to speak into that and listening to what they have to say and what their belief system is, so that you're not trying to impose your own on them, but also giving them the space to share and be open to hearing what other people believe as well.
We have a practice called Vital Talk that Dr. Anderson trained us on in another podcast, and they use the term hopes and worries. What are your hopes? What are your worries?
Yeah.
And talking through that, meeting people where they are. Yeah, really important stuff. And I know that, there's uncertainty for sure. And how do you navigate those conversations about faith and doubt at end of life?
Well, one of the things you're taught in seminary is the different belief structures and what people may believe in different denominations. And having that background and having that information in our own minds is helpful when it comes to understanding why people believe what they believe. And so, again, it's just a matter of listening to what they believe and being able to speak into that in a way that's meaningful for them. Even if you don't always agree, it doesn't matter. It's really nobody knows what tomorrow is going to bring. Nobody knows what eternity looks like because we haven't been there yet.
Mm-hmm. You know, sometimes we're talking to the patient, right? Sometimes you're going in as a support and the chaplain support for a patient, and sometimes it's for their loved one.
Absolutely.
Yeah. And so how do you ever experience where maybe a caregiver's faith tradition might impact, their loved one that's being... Yeah.
Yes, very much so. There's a couple of patients that we have on service that I don't provide care for them directly, but for their loved ones.
Mm-hmm.
And we have a lot of conversation around, what's heaven look like? What does life look like without your loved one? And how do we navigate those types of things? And just being that person to give them that space to share what's on their heart, what's on their mind, and just to bring hope to them and the understanding of, how they're feeling when it comes to their grief, because they're already starting to have the grief before their loved one's even gone.
Yeah. Can you share a couple of stories or a story, just one, about how you've supported one of our patients or their loved ones?
I have served a patient in the past, and he was a Navy veteran, and I'm also an Army veteran. So we kind of connected there. And in our conversations, we didn't really share a whole lot about Jesus or God and his spiritual background as much as just his military service and the camaraderie that comes along with. And he shared a whole bunch of stories with me. And one day his son was there while I was visiting, and I got to hear a lot of stories he'd never heard before. And his dad wasn't really all that verbal. He didn't really talk a whole lot to the family. And so having him experience that was just wonderful.
What a gift.
He thanked me not just for being a friend and a pastor and a chaplain to his father, but just for being able to experience those stories that he otherwise probably wouldn't have ever heard.
That's so beautiful, and harvesting those.
Yeah.
As a hospice chaplain, you also support our team members. I'm thinking about maybe the nurse or the case manager that really gets connected with their patients, right?
Yeah.
And how do you support our internal team as well?
Well, as I see them throughout the facilities or in the homes, I just say, hey, how are you doing? How do you feel? What's going on with you? I haven't been here that long as of yet, so still building some of those relationships, but just being able to see our nurses and social workers, feeling that connection and that upcoming loss, and giving them the space also to just talk.
Yeah.
And as a pastor, chaplain, the things that we talk about are between us and God and nobody else. And I want them to all to know that I'm not going to share anything that you've shared with me unless you want to share it to somebody else. It's not going to be said. So I think just knowing that they have that space, they have that person that they can talk to is important. And self-care is very important when it comes to hospice care.
Yeah, we had you in our leadership circle. We've had a lot of loss recently among our leaders, and just, again, grief happening. And so acknowledging that, bringing you in to pray and have some discussion about that, and even help with planning. And planning can be a big piece. I think sometimes people plan their vacations and spend more time doing that than maybe they do their end of life.
Absolutely.
Or their loved one's end of life. And so that can be a real gift that the chaplain starts to open up those conversations.
Yes.
Yeah, good stuff. Talk a little bit about what you wish that people knew more about your role as a chaplain.
I think a lot of times people view the chaplain as the moment that we're ready to say goodbye. The
last rites.
The last rites, the final prayer. But being a chaplain is so much more than that. And having a chaplain on service is so much more than that. Again, it's just an opportunity to share space. And we don't always have to talk about God. We don't always have to talk about religion. We can just talk about life. And I think that it's just important that people know that I'm here not just as somebody to share the scriptures with you. And we sing songs together. We share life together. I bring my guitar every once in a while and play some music.
And you harvest those stories for the loved ones to have.
Absolutely. And
good
so
stuff.
I think it's just important that people know that I'm not just a Bible thumper, if you will, but somebody who wants to come alongside and just help with that spiritual help and emotional help. I know we have social workers that really look into that emotional health a lot more, but I think that the spiritual and the emotional really run hand in hand when it comes to being able to share and have that hope.
Yeah. Having the chaplain on the personalized care plan for our patients and their loved ones is a vital part of, hospice.
Yes.
And I love that we have an opportunity to do that in healthcare.
Yeah.
What is your perspective on life and death, and how has it changed since working in hospice?
I didn't really think about death a whole lot in my younger years, as many people don't. Until you're faced with it, until you experience it and see it in others, it's really difficult to even have those conversations with your loved ones. And so being in hospice care and having experiences where I've seen death and I've seen people struggle with physical, medical needs, it's changed my perspective on a lot of things. I take care of my family differently. I'm not perfect in it by any stretch of the imagination, but we tend to take for granted those that we love. And when it's time for them to be gone, we have so many things that we wish we could have said or should have said. And so I try to make every moment count and not let things go unsaid.
Well done. Yeah. Well done. Mark, thank you for joining us. This is Better Together, a podcast dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question you would like to learn more about a specific topic, you can find us at ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every single moment count.